Hello and welcome to Pregnancy Info. Today we are going to explain the newborn jaundice, causes, symptoms, and home care tips. More than half of newborn babies develop yellowish skin in their first week of life. For many parents, this becomes a big source of worry. Is my baby sick? Do they need medicine? In reality, most jaundice cases are harmless and temporary. In this video, I'll explain what newborn jaundice is, its causes, symptoms, safe home remedies, and when you should definitely see a doctor. These simple tips will save you a lot of unnecessary stress and give your baby a healthy start. Number 1. What is newborn jaundice? Newborn jaundice is a condition where your baby's skin and sometimes the whites of their eyes turn yellow. The yellow color comes from a substance in the blood called bilirubin. Normally, the liver processes bilirubin and removes it from the body. But in newborns, the liver is still immature and works slower than in adults. This means bilirubin builds up, giving them yellow color. It might look scary, but here is the truth. In most healthy babies, jaundice is mild and disappears naturally within 1 to 2 weeks without causing harm. Number 2. Why does jaundice happen? What are the causes of this problem? Number 1. Immature liver. A baby's liver is like a small factory that isn't fully open for business yet. Since it's not working at full speed, bilirubin removal takes longer and the skin turns yellow. This is the most common cause and is usually improves as the baby grows. Extra red blood cells. Babies are born with more red blood cells than adults to carry oxygen in the womb. After birth, their body starts breaking down the extra cells, which releases bilirubin until the liver catches up. Some babies turn yellow. Breastfeeding jaundice. In the early days, some newborn doesn't get enough milk either because they are sleepy or because the milk supply hasn't fully started. This means bilirubin isn't flushed out quickly, but this doesn't mean breastfeeding is bad. In fact, feeding more often is the best solution. Rare medical causes. Sometimes jaundice can be linked to serious conditions like blood group mismatch between mother and baby, enzyme deficiencies, or infections. These are rare but important for doctor to check if jaundice looks very strong or develops usually fast. How to recognize jaundice? What are the symptoms that you can guess that it is a jaundice? Number 1. Yellow skin. The usually yellow coloring starts from the face and then spreads down to the chest, belly, arms, and legs. The most it spreads, the higher the bilirubin may be. Number 2. Yellow eyes. The whites of your baby's eyes can also appear yellow. This is a classic sign parents notice first. Sleepiness and poor feeding. Babies with jaundice sometimes feel extra sleepy and hard to wake. They may not feed properly, which makes jaundice worse since less bilirubin leaves the body. Parents' tips. Press your baby's skin gently with a finger. If the spot looks yellow instead of pink, it's a sign of jaundice. Safe remedies and home care tips. Here we will describe some remedies that you can do in the home. Frequent feeding, nature's medicine. The most powerful natural remedy is simple. Feed your baby more often, every 2 to 3 hours. Aims for 12 feeds in 24 hours. Each feed helps your baby pass urine and stool, which carries bilirubin out of the body. A well-fed baby is a baby that recovers faster from jaundice. Indirect sunlight. Gentle therapy. Sunlight is another safe helper. Place your baby near a bright window for 10 to 15 minutes twice daily. Sunlight helps break down bilirubin in the skin naturally, but remember, never put your baby directly under strong sunlight as it also causes sunburn and dehydration. Keep baby awake during feeds. Many jaundice babies are very sleepy. To make sure they drink enough, gently rub their feet, change the diaper, or tickle their ears to keep them awake during feeding. More feeding equals faster recovery. Monitor hydration. Count the well diapers. After the first week, your baby should have at least 6 to 8 wet diapers a day. Good hydration means bilirubin is leaving the body effectively. If diapers are fierce or very dark, it's time to consult your doctor. What is not a remedy, but parents often think it is? Number 1. Sugar, water or honey. Dangerous for newborns, never recommended at all. Stopping breastfeeding, wrong. Breastfeeding actually helps jaundice clear. Herbal remedies, no specific proof, may even harm the baby's liver. When should see you a doctor? What will be the situation when you see a doctor? Number 1. Jaundice in first 24 hours. If your baby turns yellow within the first day of life, this is not normal and needs immediate medical attention. Rapidly spreading yellow color. If the yellow color deepens and spread quickly from face to feet, don't wait, see your doctor. Baby too sleepy or refusing feeds. If your baby is very hard to weak or not feeding properly, it's a warning sign. Unusual urine or stool. Dark colored urine or pale, chalky stools can mean the jaundice is due to liver problems. Always consult your pediatrician in this case. Hospital treatments if needed. Doctor will diagnose the intensity of jaundice, then do the therapy. Number 1. Phototherapy, the blue light cure. If bilirubin levels get too high, doctors use phototherapy. This is the safe treatment where your baby is placed under a blue light that breaks down bilirubin quickly. Babies often improves within a couple of days. Exchange transfusion, very rare. In extremely rare and severe cases, doctors may replace some of the baby's blood with donor blood. This treatment is almost never needed if jaundice is noticed early. IV fluid. If baby is refusing to take feed, then there will be the chance of dehydration. Then extra fluid will be given through the veins, and this is called IV fluid treatment. Final words for parents. Newborn jaundice is extremely common, and in most babies it's harmless. With frequent breastfeeding, gentle sunlight and daily monitoring, you can safely manage mild jaundice at home. But remember, trust your instincts. If you feel something unusual or your baby looks very yellow and weak, seek medical help immediately. If this video helped you, don't forget to like, share and subscribe, and check out our playlist on newborn health motive. Parenthood is full of questions, and with the right guidance, you can face them with confidence and calmness. Take care. Bye-bye.